And hi, good afternoon. Thank you so much for joining us here on this Sunday program. We appreciate your time with us. And hard to believe already, we are into the month of August. Summer is going by the wayside. School starting up very soon. And over the last couple of weeks, maybe you've had the plans to go out with the family for some beach fun. But a lot of times over the last couple of months, that has not involved the Maumee Bay State Park, where we all are familiar with it. We have been out there multiple times, but a lot of the water quality issues, which we talk about here on 13 ABC Action News, have come up time and time again. Is the water safe enough for the family to go out there and swim? We have got some people from Columbus joining us today here on the Roundtable. Jim Zeringer is director of the ODNR, the Ohio Department of Natural Resources, joining us. Also Scott Nally, he is director of the Ohio EPA. Gentlemen, thank you so much for taking your time, bringing yourselves up here to Toledo to talk about this issue. And let's just open up the discussion as far as what I said. Personally, I take issue with the fact that I don't feel comfortable taking my kids out to Maumee Bay State Park. Right or wrong?
Jeff, that's a good question, and actually wrong. Let's start with that. There are good algae and there are bad algae. And obviously we've tried to work on the awareness through our websites to help educate folks so they understand what is a bad algae, what is a good algae. You know, algae is natural, and algae is required to help the fish communities survive. Mm-hmm. And our western basin is one of the more healthier fisheries in the world. And we are by far the best producer of all the Great Lakes. So the carte blanche that algae is bad is not necessarily an accurate statement.
Where did the stigma start? I mean, there's that mindset. In fact, you can see it in the video. Every time we go out there to shoot video, it's deader than a doornail. There's nobody on the beach, and it hasn't always been that way.
The stigma is, you know, it's a visual. And you can smell it. There are certain ones that obviously produce like sulfur and different things like that. So it becomes an aesthetic issue that then quickly gets converted to a health issue. Yeah. Now, granted, there are some of those that are aesthetically unpleasing that do produce the toxin. You know, it's the toxin that's of issue. Okay. And there are certain types of the algae that will produce the toxin. And then there are certain, you know, even though you have that type of algae present, that doesn't always necessarily mean that you'll have the toxin present. So oftentimes it's just a visual cue. So people look at it and go, wow, I got bad algae out there, I'm not gonna get in it. Where they should look at is our data sets on our websites to look and see, are we producing toxin today or not? Yeah. Is it safe for us to be out into the bay or into the lake or not? And a good rule of thumb is just stay out of the algae. If you have a concern, stay away from the bloom.
But it is one of the more shallow lakes, correct?
Correct.
And does that pose a problem as far as, I guess, the ability for it to get healthy?
It does, Jeff, and I think in this area, the average depth of the lake is 24 feet, and that is really shallow. And but to answer your first question, is Maumee Bay safe? Like Director Nally just said, there's ways to check every day on what the status is of Maumee Bay and a lot of our state parks. And yes, it is safe. I don't know what the levels are today as we speak, but it's easy to find out. And again, you just have to be careful. You don't want to drink lake water. Even if there's no algae in it, you don't want to ingest the water. It's just not as safe as what it should be.
Let that be lesson one today here on the Roundtable. Just put that out there.
There you go.
Don't drink lake water.
But like Director Nally said, there's good algae, there's bad algae, and we try to keep on top of the harmful algal blooms. And we check the levels. They are very, very low. But again, when you have children, small children and elderly folks, their immune systems aren't probably what ours are. Yeah. So you want to be cautious. But throughout the whole state of Ohio, not just Maumee Bay, you want to be careful, not only the state, the country. Yeah. So this is just an issue that we're dealing with. Why is it more prevalent up here? Boy, there's a lot of things that go into it, and the clarity of the water, you know, maybe caused by global warming. If that's happening, we can debate whether or not it's man-made or naturally occurring. But the temperature of Lake Erie is reaching 80 degrees more than what it used to be. And that may be triggering some of this. And that might be caused because zebra mussels make it clearer. I mean, there's just so many dynamics that go into this area.
But sitting in 2013, I mean, we were supposed to have flying cars by now, and we're thinking to ourselves, why can't we figure out making our natural resource better? You know, is it really that simplistic?
No, it's very complicated because there are so many different moving targets, whether it be agriculture, whether it be combined sewer overflows, whether it be factories, whether it be the number of 100-year rains that we've had in the past couple of years, that usually you get a rain like this every 100 years.
Right.
All of a sudden we've had 7, maybe in the last 5. I don't know if those numbers are exact, but we've had some larger rains. We've had some changes in farming practices over the past 35 years. There's a lot of dynamics and invasive species. A lot of dynamics have gone into why we're dealing with this situation in 2013 when we thought we might have cured it back in the 70s and 80s. But,
so we talk about health on 2 dynamics, health of the water, health of the Great Lake, health of us going into it, and you're checking off on both, Scott.
That's correct.
Yeah.
And when you look at, like the director has said, when the timing issue, long-term control plans, the CSO, combined sewer overflow issue, that is a major culprit to this. I mean, you're talking at a standard year rain event, if you kind of average out all the rain over an annual year, there's 9 billion gallons of raw sewage in 2013 that hit the lake. And we have to address that. But
and the year's not over.
And the year's not over. So as we address that, you don't address it the first week, it takes years. So a lot of these communities have lodged long-term control plans either in court or through my signature, and they are 20-year plans. So some of them are in year 3, some of them are in year 7, but they're a 20-year plan to address this because it is significant amount of money at the local level, which then gets transferred to you and I as the users.
Right, and I mean, there have been warnings that go up. You've seen this, these are posted online. Have fun on the water, but know that blue-green algae are in many Ohio lakes. Their toxins may be as well. So the warnings are there, but I mean, is that just, we need to accept that's the day and age we're in, those toxins exist. Companies line the lake. Companies have to line the lake. They need the water. They need to be close to it, and the runoff is just going to happen. But we're going to get into our second segment. Don't get me wrong. We're going to get into our second segment about the work that is being done along the Maumee River, the farm fields, and so on. But I have a hard time just being accepting, I guess, of this.
It's self-accountability. It's going to take all of us to fix it. And it's going to take all of us to also be aware of it, so we don't have it as
all of us who? All of us who are in government positions? How do I do anything?
And well, that's the signage. You have some self-accountability. We can't, as government, be everywhere, every place. We don't want to be. And it's kind of, the analogy when we were developing those is kind of like the shark signs out on the West Coast. Swim in the water, but swim at your risk. Yeah. But do be aware that there are sharks.
Right.
Same thing here.
Same thing with the foul ball at a Mud Hens game.
Exactly.
Yeah.
So it's same analogy. So you have some self-accountability. You should be aware that there is an issue. And if there is, avoid it.
Yeah. Where does the Ohio Department of Health come into all of this?
It's one of our main partners.
Okay. And they are looking at this, and I guess in a realm of badness, if you will. Obviously, Grand Lake St. Mary's down in St. Mary's, Ohio, one of the target areas. In fact, we had a map that we put together, we grabbed online. I don't know if we've shown that to our audience yet, but as you look at where the harmful algae blooms are, this is taken late last week on Thursday, and it's showing down in the Cincinnati area. There's an area down there, but Grand Lake St. Mary's, obviously, saying that recreational public hazard there. But up in our area, our neck of the woods, right now as we speak, no issues to be addressed according to the health department. But when you look at it from a statewide, point of view, is Lake Erie, is the Maumee Bay a problem area? Well,
it's an area that we're going to work with because there's a large amount of agriculture in the Western Basin. And Grand Lake St. Mary's that you talked about down in Mercer and Algae County is really turning into a success story. That is, again, a shallow lake. The average depth is right around 6 feet, hand dug, 13,000 acres. The watershed that feeds it is extremely small. 50,000 acres.
So there's not a lot of motion. And
That's
the ability.
right.
Somebody, and correct me if I'm wrong, there was somebody who was giving a press conference a couple of weeks ago where they said you look at big pieces of water, the oceans, the seas, what have you, and there's a continual turnover. When you look at lakes, Lake Erie, for example, that water stays stagnant, especially in the shallow areas. That's what you're referring to as far as St. Mary's is concerned.
In Grand, and I've heard the ratio one time that the watershed should be 8 times bigger than the lake itself for a healthy turnover. In Grand Lake St. Mary's, you got almost a 15,000 acre lake, 13 some, and a 50,000 acre watershed. So it's just a little over 4.
Yeah.
So but the farmers in that area, it's primarily agriculture. In fact, it's all agriculture. And so we're working with those folks. Every farmer in that area that has livestock has a management plan, a nutrient management plan. And so they keep track of the nutrients they put on their land, they incorporate them. If they don't need
how
them.
many years ago? I mean, how new is something like
this
that?
This is pretty new.
Yeah.
In fact, as of January of this year, 2013, they all had to be in compliance, which I believe there were a couple that weren't, but now they all are.
Yeah.
And so, but now we're talking 50,000. Now we're looking almost like a 3 or 4 million acre watershed in the Western Basin, and a lot of agriculture and good farmers and a lot of grain farmers. Not as much livestock in a concentrated area as we do, but we just feel that a lot of signals point to phosphorus.
Yeah.
And one of the biggest loading issues we have comes from agriculture. Yeah. And so that's why we're working with the farmers and the agricultural community, the Ohio State, the farm bureaus and the farmers unions. They're all working together to try to work with the farmers to come up with a plan and reduce nutrients. And we're doing it. We have over 40,000 acres signed up in the 5 counties that you mentioned just a minute ago.
Yeah, we're going to talk about those in our next segment. And Director Nally, you said the Ohio Department of Health, a great partner in all of this.
Great partner. Yeah, they helped us originally develop the first HAB, the Harmful Algae Bloom Protocol. And then we've recently modified it, actually a couple of times. We consider that a living document. And because of their interaction with CDC, Center of Disease Control, at the national level, they've been helping us make sure that we are engaged with what other states are doing, and especially from an accountability standpoint. And then at the local level, they're helping us sample, they're helping us do the notifications, we have the signage up. So it takes all the partners, and Department of Health is one of our major partners.
All right, stay right there. When we come back, we're going to talk more about this Healthy Lake Erie Fund. Farm fields, farmers, not even next to the water, are having to implement new standards, new procedures, making sure that down the line, the water's healthier. We'll be right back.